Hi, I'm Dr. Nina Deep, and I'm here today to teach you how to use the MTS roller. I have my friend and patient, Lisa, who is my model today, and I'm going to explain to her, she's never used it before. These are the things that you'll need before you start. It's the MTS roller, the sterilizing solution, and the Hydromax. Alright, so the MTS roller comes like this. This is a 0.3 roller. You'll see the words MR3 written across the top there. And this is how it comes. It's all individually packaged, sterilized with surgical grade needles protected in this little styrofoam, and that comes right off. And then if you can close up, you can kind of see the needles. I know it's really hard. They're 0.3 millimeters long, and they're tiny, tiny, tiny needles. So Lisa, this is basically what I want you to think about, is poking as many holes in your face as possible every night. Yes, so what you're going to do is start in that motion, and you can press as hard or as lightly as you want. And that's perfect, just exactly like what you're doing. And if you, I don't want you to be afraid to get right close up under your eyes. When patients start doing this roller, they sometimes start 2 minutes twice a week, then they go to 3 minutes 3 times a week, but eventually 5 to 10 minutes a night, every night, and it'll just revitalize your skin. So how does that feel, Lisa?
Feels awesome. Feels
okay.
Great.
Does it hurt on your forehead?
Not at all. Not at all. It feels very good.
Okay, so you can see, I don't know if you can tell, that she's getting a tiny bit pink. There's a little bit of histamine release that occurs immediately after you basically are puncturing your skin with these tiny little needles. So a little bit of histamine release occurs, which goes away in about 20 minutes. If you really get a lot of histamine release, just be aware that it'll go away in about an hour. If you're already on antihistamines for allergies, you may not see any pink at all. But what I tend to do is go over my face, and I'm just rolling, and then after like a minute or two, I just move to my other cheek, do it for a minute or two, and then let me show you this really great way to do your lips. You can do it for, well, actually, I'll show you how I do it. So basically, I just go right there and then right over my lips. How does that feel?
Fine.
Okay, now you do it.
Okay.
So what's fabulous about this is that you're just putting holes in your skin, and there's 3 ways this will rejuvenate your skin. One way is the mechanical degradation of lines, acne scars, pores. So mechanically, those needles really just poke through them. The second way is it stimulates, and this is the most important way, it stimulates this wound healing cascade, which is phenomenal. So basically, it tricks your skin into thinking that it's wounded, and your skin just starts secreting all of these growth factors, like tons of growth factors. The epidermal cells, which are just 0.3 millimeters below the surface of the skin, communicate with the dermal cells, which are much deeper. And you'll actually see not just epidermal changes, but dermal changes. That means you'll see not only superficial changes with lines, pores, wrinkles, brown spots, but you'll see deeper changes that includes tightening of the skin. So really, it's very simple. You will spend 5 to 10 minutes. Do it like that. You can go right over your eyebrows. You can go right in between your eyes. Do you have any questions?
No, I love it.
Okay.
Absolutely love it.
Simple to use.
Yes.
And there's really no mystery or magic on how to do it. Don't make it complicated. It's very simple. You're poking holes in your skin, as many as you can. And then after you're done, you can apply this. So this is Hydromax. It's new, so actually you might have to pump it a few times. But go ahead and just put some on your finger. I usually use just about, a squirt or 2. Okay. Yeah, right. And it really glides on easily, so you'll see, yeah. And it'll soothe your skin. Doesn't that feel nice?
Feels great.
I know.
Feels very good.
Okay, so the only other thing is how do you clean your roller? It's very simple. This roller comes with a hydrating or sterilizing kit, which includes alcohol. You drop a little alcohol on that, so on this little pad, and you go like this. Occasionally, if you feel like you've got stuff on here that you want to brush off, you can take this little brush and, well, you can take this brush and just brush off the needles. Then you can just use a little alcohol, drop it on there, clean it like that, and you're done. Put it away till the next night. All right, thanks a lot. Call me if you have any questions.